happy you're going to have a baby.
Leonora Mate is telling her cousin why it's important to get tested for HIV when pregnant.
Take care of the baby. Have you done any testing? HIV testing.
The 26-year-old knows testing could reduce transmission of the virus from mothers to babies if a woman is infected. Leonora was born with HIV. Her 8-year-old daughter is HIV negative, something she's very proud of. But she says too many young people continue to be infected. The health department says more than 2,000 South African women between the ages of 15 and 24 are infected with HIV every week. Leonora says part of the problem is that young people find it hard to talk to adults about sex.
Whether old people like it or not, young people are having sex. It would be easier if condoms were in toilets, because no one would ever go to the teacher and ask for a condom. You feel intimidated. It's like going to your mom and asking for condoms.
We know young people are dying of HIV, the new infections that we have.
South Africa has the world's highest prevalence of HIV. The United Nations estimates around 7 million South Africans have the disease. These peer educators are part of an organization called the Dynamic Youth Group. They are young South Africans who say progress has been made over the years, but too many of their relatives and friends continue to die. Many feel their parents, religious leaders, academics and AIDS experts aren't listening to young voices.
And it really hurts, because we are the ones who, since we are working in the ground level, we are the ones who experience these things, and it's painful.
The humanitarian organization Doctors Without Borders says an unacceptably high number of people continue to develop and die of AIDS-related diseases across sub-Saharan Africa. Poor education, a lack of youth-friendly services and stigma are partly to blame for the rise in new infection and death rates. Some people feel embarrassed and think twice about visiting a clinic to get tested. The stigma surrounding HIV and AIDS is still ingrained in many communities. That sometimes means infected people are diagnosed late or receive no treatment at all. Young activists say the problem isn't that young people don't know about HIV and AIDS or how to protect themselves. Many do. The challenge is creating spaces where they feel comfortable talking about and accessing those services without being judged by those who feel talking about sexual health is taboo. Haru, Mutasa, Jazeera, Ekurhuleni, South Africa.